It's Destination Newry, it's the morning programme. I'm Rowan Hand and I have the privilege each day, also the pleasure, because it's not always that privileges are pleasures, but it is both for me, a privilege and a pleasure, to be your host for 3 hours every morning from 7:30 until 10:30 Irish time. With me, you may remember, we had Maria with us a year ago, or just under a year ago, Maria Taffee of McNally's Chemist on Monaghan Street in Newry. And at the beginning, there some months back, we were talking to you about the new development of the robotic server in the shop, and we were talking to you about the kiosk where people at the front of the health centre or the health village, when they come back out onto Monaghan Street at Iceland, can put their prescription into the machine and blah, blah, then walk down the street and it's sitting there ready for them. That's still going well, yes?
Yes, Rowan, it's still 100% successful.
Wow.
We're very proud, as I had said before, to be one of the few pharmacies with a dispensing robot in the pharmacy, and as far as I know, we're the only pharmacy in Northern Ireland with a prescription kiosk. So
it's fantastic.
Yes.
The idea of the robotic server, which is also always managed and governed by human beings, of course, but it was intended to give more time to the staff in McNally's to deal with folk who come in, more time to consult and to talk.
Yes, of course, we want to give anybody who comes through our door is seen as a patient, and anybody who would like some help or advice, we are there to have a chat. We are there to get to know what's happening, what the symptoms are, and how we can help. And obviously we advise the best course of action then, whether that is something that we can provide in the pharmacy or refer on to GP or opticians or doctors or nurses or whoever else can help. Or
You get to know your people, do you?
Oh, we do, yeah.
Yeah, you have people coming in, your regulars.
Oh, we have
You're talking to people and they get great consolation from you, I would have thought.
Oh yes, yeah, it's nice to see familiar faces. So,
Yes,
and
yeah.
new faces also. We get to know people quite quickly once they're in and out.
The big thing they're coming to you for at the moment is this awfulness of summertime, hay fever.
Yes, yes.
What is it? Lots and lots and lots and lots. Is it an epidemic almost of hay fever?
Well, you could almost say that. You could almost say that. I could start by saying antihistamines are what we use to treat it. So antihistamines, as the name suggests, they block the effect of histamine in your body.
So what is histamine, first of all?
Histamine is a protein that's produced by your immune system, which produces an allergic response. So you're talking allergies.
So you breathe in the pollen. The histamines in your body say, yeah, that's pollen, I don't like it.
Yes.
And do they come and...
That's what happens. The effect of the histamines produces your runny nose, your itchy eyes, rashes, rhinitis.
It's a good thing that the histamine is doing.
It's
driving out the pollen. It's protecting the body.
Well, almost.
Yeah, that sort of thing.
Some people would disagree with the effect of the histamines.
Absolutely.
Yeah.
So you take the antihistamines and that takes care of the...
Hopefully it blocks the effects of the histamine on the body. So your body, the pollen comes in contact with your body. Your body says, hey, this is a foreign substance.
Don't want you.
We don't like this. So in order to stop, the allergic conjunctivitis, the itchy eyes, the running nose, the sneezing, you want to block the histamine. So we're talking antihistamine tablets.
Yeah.
A lot of them are available in the pharmacy. Some are prescription, but a lot of them that will treat hay fever effectively are available in McNally's. So if anybody's having any problems, call in.
Come in and ask for this lady. Just greet her and tell her you saw her on television.
We have a range of stuff, Rowan. There's nasal sprays. Usually it's a steroid nasal spray for people that are really caught up sneezing, runny nose. Some people really are experiencing very sore eyes. You have red, swollen eyes, really itchy. So there's eye drops for that too. Other people like natural methods. So we're talking honey, which can build up your own system's tolerance. Garlic is meant to be excellent.
Wow.
Omega-3 in your fish, your oily fish.
Omega-3,
yeah.
Do you know what I had last night? I had calamari. I got squid
Very
in
nice.
Tesco, and I cut it up and I made a batter. Talking about fish.
I wouldn't be a fan. Is
It's lovely. Did you ever try it? You
quite
did.
chewy?
No, only if it's cooked improperly.
Okay.
But to cook it properly, and properly means put it into batter, and then drop it into the fat, your rapeseed oil, and allow it to fry until golden, which is exactly 4 minutes and 10 seconds, and take it out, and it's perfect. It's lovely.
Well,
Then lemon all over it.
I'm not sure, Rowan, if squid is one of the ones with high omega. I think you should go for your sardines, maybe.
Oh, try putting batter on your tin sardines. You're
Yeah.
a bit of a problem. Yeah, of course, I understand what you're saying. People are talking, is it a good idea? So that's the antihistamines.
You'll be glad to know that there's only a moderate pollen count today. I had a look this morning on the news, and it's modern pollen count.
Yeah.
As far as I know, it's a new high-tech machine on the roof of Queen's in Belfast that measures the air counts every day. So
we're
you'll
being
be
watched
glad.
out. We're
We
being
are
looked
being
after, which is okay.
Yeah.
So if one could imagine on a high count day, just so we can paint a picture for people, if pollen was visible, would we see on a high pollen day a substantial cloud of the stuff?
Yes.
Would you really see
Well,
that?
it depends the time of the year now, Rowan.
Yeah.
At this time, grass pollen is one of the pollens which is extremely high.
Yeah.
Throughout the year, there's pollen
really?
counts. Yeah, so you're talking mold probably coming into the winter time. Some people have an allergic reaction to it. Even house dust mites can cause the sneezing. It sometimes can be confused with hay fever almost.
Absolutely.
Yeah.
And are there creatures in your house that crawl around your bed and you can't see them and stuff?
I'm sure there
Are there really?
Dust mites.
Is that what they're called?
Dust mites. We all have plenty of those in our homes.
Goodness gracious. Throw out the carpets, put in tiles, and get rid of them if you can. Now, I was reading during the week that the nice people, those people who clinical excellence,
The National
Institute of Clinical Excellence, has said that I'm doing no good if I take my 75 milligrams of aspirin every day to keep my blood nice and thin and okay, and to assist in cholesterol-related things, and to assist in, if ever I was in a position I was going to have a stroke, that the lower viscosity of the blood
This is actually a very topical subject this month.
Really?
Yes. The new guidelines have just been released by NICE, as you said, and really NICE as an institute are the gold standard for treatment of all kinds for all healthcare professionals.
Wow.
So what they say, kind of it goes, it sticks, and that is what people follow. Yeah. So this month they have been very specific in what they have said. It's stroke in patients with atrial fibrillation.
You must have that.
Yes.
So if I've got atrial fibrillation, that's the arteries in my heart.
That is your heart isn't pumping correctly. So sometimes it can be fast pumping, and that means that all the blood just isn't getting out of the heart.
Wow.
And because there's that pooling, this is a very layman's term explanation.
Pooling is a good word.
Pooling of blood.
It stays.
Yes.
And if it's pooling, that presupposes that maybe it's not a clot because it's not fresh blood.
Yes. So in order for patients with atrial fibrillation to prevent them having stroke, you need to have something to prevent these clots forming, so an anticoagulant.
A wee bit more than aspirin for them.
This is the new guidelines, Rowan.
Yeah,
so
I can understand that.
People with atrial fibrillation are up to 5 times more likely to have a stroke. And as we both know, a stroke can be very debilitating.
Yes.
It can be life-changing. Obviously, it can be mild, but on the other hand, it can be extremely serious and change a person's life. So NICE are estimating that up to 12,000 strokes occur per year in people with atrial fibrillation, and up to 7,000 of those could be prevented if people are given the correct anticoagulant treatment. Yeah. So aspirin and warfarin in the past were seen as the best, but now newer agents have reached the market. So we're talking Xarelto, Equilus. These are brand names, they're pretty new, but they seem to be actually doing a better job of preventing coagulation of the blood. They're new novel anticoagulants, and it is said that they are going to be the best for helping, and there nothing's a guarantee these days.
Of course.
But helping prevent stroke in patients with atrial fibrillation.
You see, you've done an enormous thing here this morning. You've shown me, you've taken me inside, inside my heart, and you've shown me the possibility, if I have atrial fibrillation.
We call it AF for
AF,
short.
if I have AF, atrial fibrillation, if I have that AF, you've demonstrated that there is a pool, let's just call it stale blood, that's there. It's not getting boom, boom. It's hanging around. It's lazy blood. And lazy blood becomes stale blood, and stale blood becomes coagulated blood. So it forms a clot.
Yes.
And this new stuff, you can get it, you can see it in your mind's eye, your heart, the stale blood, pool of it, you want to deal with that, keep it moving, and to keep it moving you put this new stuff in that's coming on the market.
To keep it nice and flowing, it's not going to dry up and create a clot. They want to keep it flowing as possible, so no coagulation at all.
Yeah, so I don't have the AF, and because of that I'll continue using my 75
it's very specific what their new guidelines are. It's for patients with AF. It could be extended now that obviously they've started looking into this. There's clinical studies, clinical trials continually ongoing. So you never know, this time next year I could be sitting here telling you something different.
New, but I mean, it's the art of the possible. We're growing all the time, aren't we, in these things? There's no doubt about that.
So anybody that's concerned, obviously they can come in and have a chat with their pharmacist. Yeah, that's fine. And if they are, suffering from AF and they're considering that that they are at risk, they definitely could get a clinical assessment from their GP. Yeah, their GP would be the first port of call for their regular checkup to make sure everything's fine.
What else is bringing people to your doorstep at the moment?
We are seeing a lot of insect bites.
Wow.
Yes.
Which kind of insects?
Well, at this time of the year, you can imagine bees and wasps. So.
But they're simple enough. Bees and wasps.
Well, if one stung me or you, I'm sure we complain about it.
But we wouldn't die from it. We'd be all right.
Well, that's actually an important point, Rowan. Some people do have severe allergic reactions to a bee sting or a wasp sting. So you're talking anaphylactic shock, and that's obviously very serious.
I've heard of young people dying from it.
That's a call for 999.
Absolutely.
Yes.
How would you know it's anaphylactic if you and to make the 999?
Yes, in a general term, you definitely would know. People usually would experience problems breathing, and itchiness all over their body, severe swelling. They would find that their throat, closing in.
No matter what you would call that, you would send for 99. You would hit 999 anyway.
Yes, and obviously people that are known to have these sort of allergies, they would have an EpiPen, which is a shot of adrenaline at hand at all times.
Goodness gracious.
Yes, but for most of us, we're okay. We don't experience those symptoms. So a bee sting, unfortunately, a bee leaves its sting behind, and you want to try and get that out.
Oh, really?
Yes, not with tweezers you're squeezing now, because that can actually burst the venom sac and spread.
I didn't know any of this, did you?
It's actually advised a bee sting, you would pick it out.
You pick it out, just...
Pick it out with a fingernail.
With a fingernail, just, hello little bee sting, come.
Yes, you would see it coming out, yes.
Really?
A wasp sting and other insects, they don't actually leave a sting, they kind of inject a venom almost. The best thing to do with any bite or sting is wash it with clean soap and water.
Bite or sting, wash it with clean soapy water.
Yes, some ice.
Ice?
Yes, and give it a little bit of time.
Little bit of time.
Yes.
What about sucking it out? I've seen cowboys where you get, the snake gets you, then you cut it with a knife and you suck it out and and everybody's happy.
Thankfully, we're not in the Wild West here, but I wouldn't advise. I wouldn't
not a
advise
good
that.
idea.
No.
And we have no creatures that are of severe enough venom to need us. To
Well,
do that.
this warmer weather, it
Yeah.
seems to be showing a new influx of different
Really?
types. Yeah, different types of
coming in
creatures.
mind.
Yeah.
The one thing that you used to be very careful of when I was in Africa and India, mosquitoes. The best cure against a mosquito is not to get bitten. That's the best thing. And then we used stuff with DEET in it, and that helped us quite a considerable.
Yes.
But then there was another thing I saw it in news recently, and you probably don't know about this. Laramine or it's a name like that. But it's now putting people nuts in the head afterwards, and they shouldn't be doing it.
Oh, okay.
Laramine. But the American Army got rid of it about 5 or 6 years ago because they thought it was not a good bit of kit to be putting into the soldiers. But the British Army are still using it, and whatever, I don't know.
I must have a look into
Yeah,
that.
I'm sorry, I can't remember.
It's an anti-malarial.
It is an
anyway.
anti-malarial
Yes.
thing,
Yes.
and it was a very popular anti-malarial. But in the evening time, one had to be careful in the tropics because that's when they start to come out on the wing, and it was only a particular type of mosquito would get you. I think it was the female.
Well, we're lucky in this country, and so far as no mosquitoes yet,
None yet.
anyway.
But
Yes.
the way global changing is going,
Yes.
you know, goodness
So
gracious.
people need to remember simple measures: washing,
Absolutely.
ice,
Washing,
cover
ice,
it over. If it's severe pain,
pick,
some painkillers.
painkillers.
There's some creams in the pharmacy if they find
Yeah.
that it's if
Yeah.
a bite's very red and swollen. Come in and have a chat to us.
I
can
had
help.
a terrible affliction the other day. I was about to fry some potatoes on my pan. You can see the burster. The burster has blistered. The blister has burst,
Oh,
and
gosh.
but it's now. You see, it's dry. It's solid. It's clean, isn't it? Now, what happened was the hot fat splashed from the pan right up onto that. Now, I immediately dealt with it. I wondered, did I do the right thing? What should I have done?
Run under cold water
I did that.
for at least 10 minutes.
I did that.
And the first aid point of view would be to cover it with cling film to prevent the air getting at the skin. And you'll find that if you do get cling film over it, it will prevent hopefully the blistering.
Yeah.
Yeah. And if it's a severe burn, so we're talking probably larger than the size of your fist on any part of your
Yes.
body, you would need to seek medical attention.
Quickly.
Yes. Yeah.
It's a very painful thing, a burn, isn't it?
It is. Yes.
I said to myself when I got it, because I'm fundamentally not a bad human being, I said to myself, Lord, thank you very, very much for giving me this instead of giving it to some old person. And then the penny dropped. I'm 70, for God's sake. I am an old person. So
Rowan, do I hear you cooking with a lot of fats?
no, I cook with rapeseed oil.
Right, okay.
Is that okay?
Well, we would stay away from oils, I
All
suppose.
oils, all oils,
I'm
yeah.
a big fan of fresh fruit and vegetables.
I am
raw,
too. Now,
Raw, if you can.
my
if you can
breakfast
eat
this
them.
morning was an orange and 5 tablespoonfuls of pumpkin seed oil.
Oh, okay.
Now, do you know anything about pumpkin seed oil?
I haven't tried it yet myself.
You might find out for me, and you're going to come back next week, aren't you, on the program? With the greatest gentleness and affection, I'm referring to Maria as my drugs and bugs woman. Drugs and bugs, that's what we got. But in essence, my eating habit is the morning time, because I've a prostate cancer that I discovered 3 years ago, but it's the PSA levels are back down again, down
Excellent.
to, I think actually there's 7 still, but they were up at 12, but the pattern is down, 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 down. So I might be okay, but if I'm not okay, then sure, that's the end of it. There'll be another something to go on to. But I was told that the holistic people say the world's greatest thing for dealing with it is pumpkin seed oil.
Oh, okay.
And I've been doing that, and it's nothing else, and that's what's brought the PSA down from 12 to 7.
Oh,
And I take it meticulously, and I feel good. There seems to be a food in it, because 1 orange, 5 tablespoonfuls, that's what I have, and then I have nothing else onto the evening time. Evening time I might have, as I told you, I had calamari, and I chopped up the squid, and I dredged it in egg, almost afraid to say this now, don't do this every day, with some beaten egg. Drop of flour, dredge it in flour, and then deep fry it in the rapeseed oil. And then it's on the plate, pristine white plate, sizzling white plate, and then squeeze half a lemon onto it. And boy, is it dear, that is great. I really enjoy that. But I wouldn't normally go for a lot of fat. But my what's that other thing? My cholesterol is 5.1. Now tell me what you think of that.
That's it's
5.1.
You want to keep it as low as possible. Obviously,
possible.
you need a small amount of cholesterol to function.
Yeah.
But as low as possible.
Yeah.
In order to keep, you want to keep it nice and low, because that is what helps cause blockage of your arteries
Yeah.
and veins, and that is not what you want to happen.
No. Should I at 70 be experiencing, if I have something wrong with my arteries and my heart and my veins, should I at 70, and anyone out there at 70, should we be experiencing anything untoward within our body? Should we feel you're out of breath, or I get a pain here, I get a pain here? And if one has a complete absence of anything like that, may one make a small assumption, and only the tiniest assumption, that it's not too bad?
Well, Rowan, you'd need to take a lot of things into account here. So age is one of them.
Never smoked in my life.
Well, you're lucky that way.
Never ever.
That's great.
Okay,
That's good
I'm
going.
doing.
Yes. So your age is one thing. Obviously, the older you get, the more chance you have of something, breaking down as such.
Breaking down.
Yes.
Knew it would come.
What other conditions you have, if you suffer from any other medical conditions?
No other medical condition known to man except my
excellent.
lovely prostate cancer. My friend, my two quarter millimeter hints of cancer from my. I insisted on 2 biopsies, but 1 each year. They weren't going to give it to me. I said, look, let's have it. Let's do it and find out. So that is, everything is normal. It's the right. Everything is great. So not that I know of. I have nothing else. So that's maybe all right too. Then what else?
As you said, your smoking status.
Never smoked in my life.
Your weight.
Weight, I'm the same weight now as I was when I was 20. I'm 11.5 stone.
That's excellent.
Yeah, that's true.
Yes, so you want to keep an eye on your weight, or your
Yeah.
BMI.
Body weight.
Yeah, body mass index.
Body mass index.
Yes, yes. Your blood pressure.
Blood pressure, according to Mark McAvoy, the blood pressure of a teenager.
Excellent.
There you are. Now, when I drop dead, Andrew, on the program, don't phone 999, keep the camera rolling. That's the thing to do. No, but I think if people are aware of these things and keep an eye on it and prioritize themselves as they grow older and look after themselves, I think that's a good thing to be doing.
Yes.
And these people who bucket huge amounts of food. I had a friend once, and goodness gracious, he died. Lovely man. I used to do a lot of film work with him, and we buried him in Cullyhanna graveyard when he died, of course. But Benny was there, and we would be in the middle of the day. We would break from our editing at his studio in Cullyhanna, and we'd go to Dundalk for our lunch. These were the days I would have taken a lunch. I've long since stopped that. But we had gone to, there's a place outside Dundalk, and lunch would come. Benny would have a plate like that, full of stuff.
Is this Mr. Woods by any chance?
No, it's not Mr. Woods. It's
No.
It's Benny Loy from Dorsey.
Oh gosh, I'm afraid I don't know.
No, he's a lovely man, a lovely human being. And then in the evening time, Mrs. Herty, next door neighbour, would ring him as I was going home to Newry. She'd, Benny, your dinner's ready. Come on in. And Benny would go into Mrs. Herty and have another. Sure, was it any wonder, I think if we take the wrong food and the wrong things, it's crazy, and we shouldn't be doing it.
That's true.
Now, thanks for coming in.
No problem.
You thought you were wondering what we were going to talk about, weren't you?
Yes, exactly.
And what did I tell you? Not to worry, that we're all right.
We could talk about anything and everything.
This is exactly right. And we'll see you same time next week.
Same time next week.
This,
Thanks, Joanne.
ladies and gentlemen, you've been listening to Maria Taff of McNally's Chemist on Monaghan Street in Newry, whom I affectionately refer to as my drugs and bugs woman. Thank you.
Thank
Go
you,
well.
Rowan.
Take care.
Thank
Bless
you.
you.